Have you ever wondered how deeply intricate and delicately balanced the human reproductive system is and how even a slight disturbance can result in significant impacts? It's quite fascinating, isn't it? The human body, a marvel of nature, operates like a well-oiled machine, with each part playing a crucial role. But what happens when this system faces a hiccup? Let's delve into this. Today, we turn our spotlight onto the human reproductive system, a complex network of organs, hormones, and processes that enable us to reproduce and ensure the continuity of our species. It's a system of such remarkable precision that even a minor glitch can lead to significant effects. We're going to explore this labyrinth of life, focusing particularly on some disorders that can disrupt its smooth running. In this journey, we'll navigate through the winding paths of three common and essential conditions: endometriosis, dysmenorrhea, and infertility. Each of these conditions, while distinct, shares a common thread. They all involve disruptions to the normal functioning of the reproductive system, and they can all have profound effects on an individual's life. Endometriosis, a condition where tissue similar to the lining of the uterus grows outside it, can cause pain and fertility issues. Dysmenorrhea, or painful periods, can be so severe that it interferes with daily activities. Infertility, the inability to conceive after trying for a significant period, can be a heartbreaking journey for many. These aren't just medical conditions, they're lived experiences affecting millions around the globe. Understanding them is not just about memorizing textbook definitions, but about grasping the realities of those who live with them and appreciating the delicate balance of our bodies. So buckle up for this exploration of the human reproductive system, its disorders, and the resilience of those who live with them. It's going to be an enlightening journey, one that might even make you see the human body in a new light. Stay with us to unravel these mysteries and perhaps even develop a newfound appreciation for the intricacies of our bodies. Imagine a condition where cells similar to the ones inside your uterus start growing outside it. Sounds strange, right? But that's exactly what endometriosis is. Endometriosis is a reproductive disorder where cells that typically line the uterus, known as endometrial cells, begin to grow in places they shouldn't. These rogue cells can appear on the ovaries, fallopian tubes, and even on the bladder or intestines. And just as the lining of the uterus thickens and sheds during a menstrual cycle, so do these misplaced cells, only they have no exit, which can lead to a host of problems. The most common symptoms of endometriosis include intense pelvic pain, heavy periods, and discomfort during intercourse. However, some women might not experience any symptoms at all, making it a somewhat elusive condition to diagnose. What's more, the severity of symptoms doesn't always correlate with the extent of the condition. A woman with mild endometriosis can experience severe pain, while a woman with advanced endometriosis might have little or no discomfort. Now, let's talk about the elephant in the room: fertility. Endometriosis can lead to fertility issues, but it's important to remember that it doesn't guarantee them. Around 40% of women with endometriosis experience fertility problems. The misplaced tissue can cause inflammation and scarring, which can obstruct the fallopian tubes or distort the shape of the reproductive organs, making it more difficult for an egg to be fertilized or for an embryo to implant in the uterus. But here's a silver lining. Many women with endometriosis successfully conceive. It might take a bit longer or require medical assistance, but it's certainly possible. It's also worth noting that effective treatments are available to manage the symptoms and potentially improve fertility. So endometriosis is indeed a silent invader, often going unnoticed until it has caused significant damage. But with the right knowledge, early detection, and treatment, it doesn't have to control your life. Endometriosis is a complex condition, but understanding it is the first step in taking control. So let's keep the conversation going. Endometriosis is a silent invader, often going unnoticed until it has caused significant damage. Painful periods are common, but when does it cross the line from normal to concerning? That's where dysmenorrhea enters the picture. Dysmenorrhea, often dismissed as just bad period pain, is in fact a serious medical condition characterized by severe, debilitating menstrual cramps. It's not your average discomfort, it's pain that hinders daily activities, making even the simplest tasks seem like climbing a mountain. Comprehending dysmenorrhea begins by understanding that it's not a one-size-fits-all condition. It comes in two forms: primary and secondary. Primary dysmenorrhea, the more common of the two, usually starts a couple of years after a woman has her first period. The pain, often described as a heavy dragging sensation, typically begins at the onset of the menstrual cycle and can last for several days. Secondary dysmenorrhea, on the other hand, is caused by underlying conditions like endometriosis or fibroids. It tends to start later in life, and the pain can begin before the menstrual cycle and last longer. So how can you tell if what you're experiencing is normal menstrual pain or dysmenorrhea? It's all in the intensity and duration. If the pain is severe enough to interfere with your daily activities, or if it lasts more than 2 to 3 days, it could be dysmenorrhea. But don't despair if you think you might have dysmenorrhea. There are ways to manage the condition and alleviate the pain. Over-the-counter pain relievers, hormonal birth control, and in some cases, surgery can offer relief. It's crucial, though, to talk to a healthcare provider about your symptoms. They can provide an accurate diagnosis and guide you towards the best treatment option for you. Don't let anyone dismiss your pain as just bad period pain. Your pain is valid, and it's important to speak up about it. Don't let dysmenorrhea steal your thunder. With the right treatment and support, you can regain control over your life and your menstrual cycle. Dysmenorrhea is more than just bad period pain. It's a real debilitating condition that deserves recognition and appropriate treatment. Infertility, a word that carries a world of emotions for many. But what exactly does it entail? Let's delve into this often misunderstood term. Infertility is the inability to conceive after a year of regular unprotected intercourse, or the inability to carry pregnancies to a live birth. It may be due to a single cause in either you or your partner, or a combination of factors that may prevent a pregnancy from occurring or continuing. Now let's look at some of the common causes. In men, infertility is often due to low sperm production, abnormal sperm function, or blockages that prevent the delivery of sperm. Illnesses, injuries, chronic health problems, lifestyle choices, and other factors can play a role in causing male infertility. In women, infertility can be due to a multitude of causes like problems with ovulation, damage to fallopian tubes or uterus, or problems with the cervix. Age can also contribute to infertility because as a woman ages, her fertility naturally tends to decrease. Now, you might be wondering, what are the options if one is diagnosed with infertility? Thankfully, modern medicine has made leaps and bounds in this field. Treatment of infertility depends on the cause, duration, age of both partners, and personal preferences. It may involve significant financial and emotional commitments. For men, treatments may include lifestyle changes, medications, surgery, or sperm retrieval. For women, treatments might include stimulating ovulation with fertility drugs, intrauterine insemination, surgery to restore fertility, or assisted reproductive technology such as in vitro fertilization. In some cases, a gestational carrier might be recommended. It's key to remember, infertility is not a verdict. It's a condition that many couples face and overcome, often with the help of medical treatments and interventions. Infertility is a journey, often a tough one, but with advances in medical science, there's hope on the horizon. So let's keep our spirits high and continue to learn, understand, and grow. After all, knowledge is power, and power can change lives. So we've dived into the realms of endometriosis, dysmenorrhea, and infertility. But what's the takeaway from all this? Let's break it down. We've journeyed through an exploration of some of the most common reproductive disorders. These are issues that affect countless individuals worldwide, and yet they often remain misunderstood. By unpacking the complexities of endometriosis, dysmenorrhea, and infertility, we've shed light on these conditions, their symptoms, possible causes, and treatment options. Endometriosis, a condition where tissue similar to the lining of the uterus grows in other parts of the body, can cause severe discomfort and complications. Dysmenorrhea, which is essentially painful periods, can be debilitating and negatively impact an individual's quality of life. And infertility, the inability to conceive after a year of regular unprotected intercourse, can bring about emotional distress and psychological challenges. These conditions are not just medical issues, they are deeply personal, affecting people's lives in profound ways. They are also social issues, impacting relationships, mental health, and societal perceptions of health and well-being. So what's the takeaway from all this? It's simple. Understanding these conditions is the first step in dealing with them effectively. Knowledge can empower us to seek help when necessary, to advocate for ourselves in medical settings, and to spread awareness about these conditions to others. Remember, If you or anyone you know is experiencing symptoms related to these conditions, it's crucial to seek medical advice. Don't let fear or stigma prevent you from getting the help you need. And let's not stop at understanding. Let's spread the knowledge. Share this information with your friends, your family, your colleagues. Let's break down the barriers of misunderstanding and stigma. Let's foster environments of empathy and support. Knowledge is power. The more we know about these conditions, the better equipped we are to deal with them. Subscribe for more because you won't find me later.